It became obvious in the early 90s that we were just not big enough here, that we were going to need an additional hospital, and we, through planning, understood now that it would have to be a campus.
We looked at, in our minds, at every conceivable option to expand right there, looking at high-rise structures, parking, terraces, etc. And after examining multiple options, felt as though that our only viable choice was to move to a new location.
So we looked around the community. We found a great family, the Formaster family, who are willing to donate part and sell part of the 50 acres east of us. And we went to them, worked out all of the things that go along with that, and secured that 50 acres, added a few more acres a little later, and then brought in a national firm, and we basically designed the entire site rather than just one building. We thought it's time to take us to 50 acres plus and design the entire campus to meet our needs, hopefully into the next 50 to 100 years.
And it was an exciting time in St. George. There was a piece of property that had been purchased here, and it was going to be a beautiful medical center. And I had the opportunity to work with the teams to help finish the last of the design of the building, think about our equipment. And then it was really a process of a 2-year build with our construction company. Whenever you move into somewhere new, and it was bigger, we had to make sure that supplies and medication and personnel and the paperwork, all the computers worked and everything, so that we could do business as usual when the patients were received over here. We didn't have one incident. It went like clockwork, moving patients back and forth. We discharged as many patients as we could and tried not to admit any more during that time period, but we still had a number of patients that had to be moved, and we got that all done in one day. And as luck would have it, build it and they'll come, we far exceeded the 20 to 30% growth that we'd anticipated. I remember at one time, if I've got the numbers right, we had 70 traveling nurses in our facility, augmented with our own staff to take care of the patients we had in the hospital. And we had many people in our hospital that have RN degrees, myself included, that were in other jobs, whether they be in casework or education or in administration, that pulled a few shifts.
You know, the part that impacted me the most, of course, was the change in the emergency department, where we went from basically 7 beds to 30 beds.
I remember one of the guys that used to work nights when I was head nurse here came in one time, and he looked across that emergency room over there and says, "Good grief, you can see the curvature of the earth across this thing. It's so big."
We had been in the River Road campus all of 1 week, and that weekend there was a major 2-car rollover with a number of young kids that were driving too fast on the road. And I remember there was like 8, if I remember right, teenagers that were seriously injured involved in that, and we needed all of our trauma rooms. If we had not been in the River Road Hospital and been on 400 East, we would have had to have shipped those patients and not been able to help them. On the heels of that, one weekend, about 3 weeks into this, we had a young father, he was 40 years old, that had come into our emergency room with crushing chest pain. And our emergency room physicians diagnosed him as not having a heart attack, but as having a ruptured aorta, which is a major blood vessel. This was on a Saturday, and we came into our hospital. Our cardiac program was up and running. Our 2 cardiac surgeons were in the hospital. Diagnosis was made in 20 minutes, and the patient was in the operating room. And the long story short is, 4 days later, this father who had 4 children walked out of our hospital. 2 weeks before that, he would have never made it.